We're in a much different place. The number of people in the hospital, while increasing, still remains below where we were last winter. And our hospital system has the capacity to handle what we expect to come in the next few weeks. To put it simply, right now we're learning what it means to live with COVID. The challenges we face from Omicron aren't what we face with Alpha or the Delta variants. Thanks to our hardworking public health leaders, our community partners, and most importantly, the people of this city, we are among the most highly vaccinated cities in the world. 81% of all San Franciscans are fully vaccinated, and 54% of all residents have received their booster. For vaccinated people, Omicron is very unlikely to result in hospitalization. The consequences today are not catastrophic. It will most likely mean you need to quarantine for a short period to prevent others from catching it. That's a stark contrast from the impact that COVID had before the vaccines. Dr. Colfax will talk more about the situation here in our city and what we know about this new variant. And we also have Dr. Susan Phillip, our county health officer, available to answer any questions. The good news is that this variant appears to be less severe than Delta. However, it is clearly much more contagious. That poses a very real set of challenges in the short term as cases spike before coming down again. For example, testing. We know with so many people returning from the holidays and so many people getting exposed to the virus, some are struggling to get quick access to testing. Last week, the Department of Public Health alone did over 25,000 tests, which is nearly double our capacity from 3 weeks ago. The city will continue to provide more tests, but if you have insurance, it's important to contact your private health provider. They should be providing options for you, and we are asking private healthcare providers to do their part, come into compliance, and make testing available for the people they insure. We're also facing challenges with staffing. Due to the sheer number of cases we're experiencing, we already have a large number of people quarantining, and this will only increase over the next few weeks. It's impacting our workforce, especially among frontline workers. We saw this in the lead up to New Year's Eve when we had to cancel our fireworks show because we simply didn't have the public safety personnel to responsibly handle such a large event. We are seeing it when there are missed runs on some of our Muni lines. And as of yesterday, we have 167 police officers who are quarantined, and we have 135 members of the fire department in quarantine, and almost 100 people in our SFMTA department, which some of those folks are Muni operators. Today, to answer your questions about staffing, we have available our Fire Chief, Janine Nicholson, our Assistant Chief from the Police Department, Bob Mosier, and Julie Kirschbaum, who's the Director of Transit for the SFMTA. They can answer any specific questions you have about the surge in cases and how it will be affecting staffing for the city. But I do want to remind everyone of this. Thanks to all of our city employees who complied with our vaccine mandate, San Francisco's workforce is well protected and well prepared to stay healthy through this surge, even after they quarantine from contracting COVID. That's why we took those proactive measures to launch our mandate last summer. And I want to be very clear with the people of this city. We are prioritizing essential city services, public safety, and other life safety operations. Transit will be running, although we're asking for your patience. Frontline workers will be putting in overtime to make up for their quarantined colleagues. Trash is still being picked up, police are still on patrol, and firefighters stand ready to respond. We're not shutting anything down. We're not closing businesses. This is not 2020, but we do need to do our part to prevent too many frontline workers from getting sick at the same time. That means we need people to take steps to avoid catching COVID during our surge over the next few weeks. Because when we have employees out, including those who are doing the testing, including our frontline health workers, it impacts our ability to provide services. We're asking people to prioritize activities that are most important and avoid those that aren't necessary and might expose you to COVID. We have reason to believe this surge of cases, while intense, will be relatively brief. Over the past 2 years, San Franciscans have shown that they can do what's necessary in order to protect one another. We locked down early. We protected each other. We got vaccinated. We got boosted. We are a healthy and safe city despite this new variant. We'll get through these next few weeks just as we got through the previous surges. I'm really proud of what this city's done, and I know all of you will continue to do what's best for yourselves, your family, and your community. Thank you all. And at this time, I'd like to ask Dr. Grant Colfax to provide more of a specific update of where we are. Dr. Colfax.
Well, thank you, Mayor Bree. As we start the new year and 2 years into this pandemic, I want to again express my gratitude to the thousands of people on the front lines in San Francisco fighting this virus every day, including in our hospitals, skilled nursing facilities, community testing sites, and vaccination clinics. Thank you to our healthcare providers and our first responders. San Francisco has a strong foundation as we respond to the Omicron variant. We are 81% vaccinated with initial doses, and the majority of vaccinated people in San Francisco are now boosted. And thankfully, that number is still growing. Omicron is facing a wall of immunity as it moves through the city. Our vaccinations and boosters are doing what we need them to do right now, which is preventing many people from getting sick and being hospitalized. But let me be clear, and let's be frank, the context of this surge is different. Breakthrough infections with Omicron are common, regardless of vaccine status. And so we are seeing this virus rapidly spread. This biggest surge yet is taxing our cities in new ways. Even more so than Delta, the new Omicron variant is forcing us to learn to manage and to live among COVID, while keeping our hospitals and clinics, schools, businesses, and many other essential services operating. We knew this was coming because we have been monitoring data and conditions as Omicron spread across the globe. And the situation is fluid, but we believe that the height of this surge is upon us and that these next few weeks are critical. We will see large outbreaks, and many people we know and love are getting COVID. However, it is within our control to limit the damage. Now, let's take a look at the data a bit more closely and see where we currently are. May I please have the first slide? May I please have the second slide? As you can see, cases are skyrocketing in San Francisco like we have never seen before. This slide shows we are currently at more than 95 COVID positive cases per 100,000 people here in San Francisco. And we expect that number to continue to climb. To put that in daily terms, an average of 829 San Franciscans per day are testing positive for COVID. And this virus is spreading rapidly. In just 7 days from December 20th to the 27th, cases grew from an average of 309 to 828, a more than 2.5-fold increase. And that's now more than double last winter's peak of 373 cases per day. And in a hopeful note, we are expecting a peak in these cases relatively quickly. Our projections show, and again, this situation is fluid, that cases will peak within the next 2 weeks, making it possible for us to minimize the damage if we are smart and take proper precautions we've come to know so well during the course of this pandemic. Next slide, please. Hospitalizations are expected to continue to go up following the steep rise in cases. And we right now project that we will reach peak numbers in hospitalizations similar to the 2021 winter surge. I want to emphasize that among our highly vaccinated and boosted city, most COVID cases will now be mild or even asymptomatic. But the sheer number of people becoming infected does affect hospitalizations. For now, we have enough hospital beds to manage this volume, which is good news. However, another concern is that hospital staff becoming infected due to community spread and having to stay home. This, of course, is true for all our frontline workers across the city. Next slide, please. As you can see, our COVID cases and hospitalizations go up together. In the previous surge of this pandemic, hospitalizations were relatively high compared to COVID cases. But with Omicron, hospitalizations are much lower relative to COVID cases. And even as hospitalizations increase, again, most people with COVID will not experience severe disease. This is good news. As the mayor said, not only is Omicron less severe, but we estimate that it's about a third as virulent as Delta, which also means that our vaccinations and boosters are working. Please, you can take off this last slide. While this variant seems to cause less severe symptoms than previous variants, the large number of people contracting COVID has an impact on our hospitals, businesses, schools, and essential city services. At DPH, our priority right now is to protect essential services and our most vulnerable populations, and we are doing that in a number of ways. We are experiencing a high demand for testing. Testing sites are booked out and home test kits can be hard to come by right now. But testing at the health department and health systems across the city are at an all-time high right now, with about 50,000 tests being administered per week across the city. Here at the health department, we did over 25,000 tests last week alone, nearly doubling our capacity from just 3 weeks ago. We are urging our healthcare system partners to also meet the additional demand. More rapid tests are also on their way. We have ordered test kits from suppliers to support first responders and the most vulnerable, such as residents and staff of skilled nursing facilities. And if we could get those tests today, we would have them and be distributing them. Unfortunately, because of supply chain issues, these kits are still hard to come by, but we would expect them to arrive in weekly deliveries starting in mid-January. And we have made important changes to our local health order and new safety guidance for hospitals and other settings. Schools are included in the city's critical infrastructure. And at the Department of Public Health, we have reaffirmed our support for in-person learning as schools have been low-risk settings with proper safety protocols in place. And even with the increase of additional cases, we have learned that the mental health and educational impacts on students due to social isolation far outweigh the challenges of in-person learning. COVID-19 has continued to challenge our city now for almost 2 years, but we know that San Francisco is in the best position possible to weather this surge because of all the hard work and dedication we have taken to protect ourselves through multiple layers of defense, including vaccinations, boosters, indoor masking, and testing facilities. This Omicron surge will be hard on every community, but it's good to be in San Francisco right now. With the city's work to minimize impacts and preserve essential services, we call on all of you to take extra care over the next several weeks. Lower your household risk where possible and layer up on your defenses. Get boosted. It's not too late. Evidence suggests that boosters start working within days, and boosters right now are key to optimizing your protection against serious disease. And for goodness sake, please get vaccinated if you have not already done so. Also, consider upgrading your mask to an N95 or double mask to improve the seal, avoid large crowds, and take extra precautions around those still unvaccinated, like our young children, our elderly, and the immunocompromised. We will get through this fifth surge, as we have with all the previous surges during this pandemic. But we need to remain vigilant and careful and take to heart the well-being of ourselves, our families, and our communities. Thank you.
Thank you, Mayor Breed and Dr. Colfax for your remarks. Before we start the question and answer portion, we're going to take a moment to allow reporters to submit questions on Zoom. I see the chat is already very busy right now. So we'll just wait a minute for any other questions to come in. Okay. Thank you for your patience, Director. Dr. Colfax, when you're ready, we'll start the Q&A.
Thank you, I'm ready.
Okay. The first question is for Mayor Breed. This question is from Lynn Melendez from ABC 7. Even though the city will not order another lockdown, are you concerned about the economy since some restaurants have closed, some through the spring?
Well, of course, I'm concerned about the economy because it's not just restaurants, sadly, that have had to close. A number of bars have had to close. Hotel occupancy is down. We are seeing challenges with businesses in general, where people who are employed in many of these small businesses and other places, just like the city, have had to make adjustments in staffing levels or make the decision to close overall because of the shortage in staffing levels. So we're going to experience some very serious challenges with our economy over the next couple of weeks, but this is, as I said earlier, what we're living with. We're not unique in terms of the experiences we're having with the shortages of staff, in that people are contracting COVID, then they have to quarantine, and we have to make adjustments. And so it is definitely going to impact our economy. But I think as we come out of this next surge, what we will see is the ability to continue to come together, reduce some of the regulations that we've imposed, and start to get back to a level of normal or adjustment in terms of how we're living with the impacts of this virus. But the good news is that we're not seeing the hospitalization rates and the death rate like we did during Delta and Alpha variants. And so we're saving lives, but in the meantime, we're going to experience some challenges with the economy.
Thank you, Mayor Breed. Dr. Colfax, your first question comes from Christian Kaftan from KTVU. In terms of our hospitalized patients, how many were admitted with COVID versus how many were hospitalized for another reason and later found to have COVID?
Yes, thank you very much for the question. So I think the key thing here is that what we're looking at is hospital capacity, our ability to manage not only people who are being admitted for COVID or admitted with other conditions who test positive for COVID, but also all the other people who are admitted to the hospital for other reasons. So really that hospital capacity number is one of the key metrics that we're watching. And right now, as I said in my earlier remarks, those beds look good in terms of raw numbers, in terms of intensive care unit beds and medical surgical beds. In terms of the total people admitted with COVID to our hospitals, I do have data from Zuckerberg San Francisco General Hospital, where we estimate about 70% of those who are admitted for COVID are being admitted for COVID-related reasons, and about 30% are admitted for other reasons and found to have COVID on testing. And we believe that those numbers generally reflect what we're seeing across the city at this time.
Thank you. Dr. Colfax, you have a second question from Kevin Trong from the San Francisco Standard. Is the city taking any steps to procure supplies of rapid at-home antigen tests?
Absolutely. We are working on our supply chains. We have multiple people working on that. As I mentioned, we have multiple orders in for rapid tests. We expect those tests to start arriving in the next couple of weeks.
Okay, several other questions for you, Dr. Colfax. The next question is from Aaron Alday from the San Francisco Chronicle. Are we yet seeing cases from holiday gatherings? And do you have a sense of how much those gatherings are fueling this current surge? And part two is, do you have a sense of where people are being exposed?
Well, I think, with Omicron, it is so much more contagious compared to Delta or Alpha. That I think just due to the increase in activity over the holidays, we are seeing a large spread of the cases. We are now seeing those numbers increase, likely due to the holiday period. And we expect those cases again to likely peak in the next couple of weeks. I think what we've seen during this 2 years of this pandemic, that the more people gather, the more people don't wear masks, particularly inside, the more the greater the risk of infection. So I don't think there's anything unique about the transmission, the risk of transmission during the gatherings, but the risk is higher because this variant is so much more infectious. So the bottom line is we think that the cases will peak in the next couple of weeks, consistent with both the virus's dynamics and the activity that we're seeing across the city right now. The bottom line also is people need to get boosted to be most protected from the poor outcomes due to Omicron, and that right now people should do whatever they can to decrease their risk, including those boosters, the masking, the layering, and avoiding large gatherings and taking your own risk into account in terms of deciding what you're going to do over these next few weeks as we see these cases increase.
Thank you. We have a few questions for Dr. Susan Phillip, our health officer for San Francisco. Dr. Phillip, can you clarify San Francisco's requirements for ending quarantine and isolation after 5 days? And is a rapid test or PCR test required after 5 days? This is from Sydney Johnson from the San Francisco Examiner.
Yes, thank you. Thank you for the question. The first thing I want to say is that in San Francisco, as in all other counties in California, we are required to be at least as strict as the California Department of Public Health. The California Department of Public Health has said in its guidance statewide that a negative test is necessary to end isolation after a positive test at day 5. And so that is the same requirement that we have here in San Francisco. A antigen test, a rapid antigen test is preferred, but any test is permitted. If people are not able to get tested at day 5, then they complete 10 days of isolation as they did before.
Thank you, Dr. Phillip. The next question is from Mel Baker from the San Francisco Public Press. Will the city be sharing testing resources with SFUSD to help the district control outbreaks in the schools?
Dr. Colfax, would you like me to answer this question or would you like to answer?
I think the point is that we are working very closely with the school district and supporting both vaccination and testing guidelines. We have a number of sites that we're collaborating again with the district on in terms of providing testing and vaccination support. And we're doing everything we can to ensure that schools will stay open because we know the importance of in-person learning. So again, we've emphasized that even during this intense surge, we are supportive of the schools remaining open and that testing and vaccination are key to that. If people have children who are still who are eligible for vaccination but are not vaccinated, please get them vaccinated as soon as possible. We're also very, we've received some positive news just yesterday, I believe, around 12 to 15-year-olds becoming eligible for boosters. We are prepared to implement that as quickly as possible. So we're collaborating with the school district during this really challenging period, and we're hopeful, given the numbers that we're seeing right now, that schools will continue to remain open.
Thank you. And I just want to mention that questions specific to SFUSD and school situations should be directed towards the school district. Okay, the next question for you, Dr. Phillip, again, is from Anlon Cheney from Mission Local. Given N95s are most effective, will the city be updating its mask policy and information on N95s to make this clear and to take actions to make these masks available to the public?
So what we are doing around masking, as you heard from Dr. Colfax, is to really give people the information about masking and what the better qualities of masks are. So yes, as you mentioned, the N95 respirators, but also the KN95s or the KF94s are ideal, are protective. There are other good ways that people can improve their protection, and that includes layering an easily obtainable surgical mask under a cloth mask to improve the fit of that surgical mask. And cloth masks are least effective right now during Omicron. So that is the general message that we are working to get out. And we've been working throughout the pandemic with community organizations and groups to help ensure that they have this information, that they have masks where possible. But anyone is able to improve the fit of their own mask by using the cloth over a surgical mask at this time. And that is a very good way to try and get a better mask in place. N95s are also available and people can receive those. We are prioritizing our healthcare workforce for those to really make sure that they remain available and that first responders also throughout the city have access to that to keep essential services going.
Thank you, Dr. Phillip. So the next few questions are for Julie Kirschbaum from SFMTA. The first question for you, Director, is from Ginger Conejero from NBC area. Will there be changes to transit schedules and lines?
At this time, we're not canceling routes or changing schedules, but the SFMTA was having staffing constraints prior to the Omicron variant, and the variant is stretching our ability to deliver service. So customers may experience longer wait times, and we really appreciate everybody's patience during this time. We're continuing to monitor our staffing daily, and we'll keep the public informed if our situation changes and we do need to cancel service. But at this time, we are delivering all of our routes. And the best place to get up-to-date information on our service is at the agency's Twitter site, SFMTA's account.
Thank you. There's one additional question from Gerald Chin with SF Bay. How many operators are currently out sick with COVID-19 and how many routes are affected?
We had 68 staff members let us know that they had COVID last week. Of those, 28 of them were operators. We also have a significant number of operators who are either quarantining because of close contact or taking care of family members who may have had secondary impacts like canceled childcare. We are seeing impacts on most routes at this time. It's primarily missing shifts and longer waiting times.
Thank you. This concludes our question and answer portion. And thank you for Mayor Breed and Dr. Colfax and our city colleagues for your time. I do want to point out there's opportunities for the press to ask additional questions. Please email dph.press@sfdph.org and we will route your question to the appropriate person. Thank you and have a great day.